Today we're going to talk about choking patients. In particular, we're going to talk about how to perform the Heimlich maneuver. So to start off with, what is the Heimlich maneuver? So this is a maneuver or a skill that is used to assist patients in clearing foreign objects from their airways. So in a choking situation. So the Heimlich maneuver should only be used if there is a complete obstruction of the airway. So the difference between what is a complete obstruction versus what is a partial obstruction. So here I've got occlusion. So a partial occlusion is when the patient has partially blocked the airway, either with food or vomit, fluids, whatever it may be. Typically, they're going to be alert and they're going to be coughing in this situation. They can get air to the lungs. However, it's not going to be quite at their normal capacity. So in this situation, if you do come across a choking patient, you're going to want to encourage them to keep coughing, because basically what they're doing by coughing is they're trying to expel that object themselves. Now, what's important to note about a partial occlusion is that a partial occlusion can become a complete occlusion or obstruction very quickly. And so that's where we get to a complete obstruction or a total occlusion. So this is when the patient will not be able to breathe at all. Their airway is completely blocked by whatever foreign object it may be. Typically, if they're alert, they're going to start performing the universal choking sign, which you see in this picture right here, where they put their hands up towards their throat. It's kind of an instinctive nature, because when you can't breathe, that's kind of the first place you go to is your throat. And in this situation is when we are going to want to utilize that Heimlich maneuver. So we're going to talk a little bit about how to perform it, and then I'm going to show you a video demonstration on how to perform it, and I'm going to go a little bit more in depth on what to do in certain situations. So of course, we're always going to make sure that we have scene safety, and we're going to make sure that we have our PPE in place before we make that patient contact. Whenever you first walk into the scene and you are formulating your general impression, you're going to be looking to see, are they performing that universal choking sign? And it's also important to note that they might have a complete obstruction of that airway and might not be performing that universal choking sign. Just because they are not performing that universal choking sign does not mean that they are not actually choking. So when you go up to your patient and you see, you notice they're not getting any air movement in or out, you're going to look at your patient and you're going to ask your patient if they are choking. If they have a complete occlusion, they're not going to be able to talk to you. So just make sure that they nod their head yes or shake their head no. So if they nod their head yes, that they are choking, what you're going to do is you're going to place your hands directly above their navel. And what you're going to do is you're going to make a fist with one hand, and you're going to wrap your other hand around that fist. And so once you make that fist, make sure your thumb is facing inwards. You're going to thrust your hands into the patient's abdomen, and you're going to kind of go in like a scooping upward and inward motion. You'll see this a little bit better in the video that I'm going to show you. And you're going to repeat this until either the object gets expelled from their mouth or they completely lose consciousness. And so when they completely lose consciousness, what we're going to do is we're going to lay them down on the ground, and we're going to immediately start performing chest compressions. And basically kind of work a cardiac arrest situation. So there are also some special considerations that we need to talk about. So for pregnant women, if you come across a pregnant woman that is choking, you want to make sure that you go right above the baby bump. Make sure you don't go too high, but you do want to go above that bump. You don't want to be squeezing into that bump. You're probably not even going to be able to get your hands around it. For infants, it's going to be a little bit different than, for instance, doing a Heimlich maneuver on an adult or an adolescent. So when you get that infant, you're going to perform 5 back blows, and then you're going to flip them over and perform 5 chest thrusts. And you are going to keep doing that back and forth until either they expel the object or they lose consciousness. And then you're going to start doing compressions. So for obese patients, it's very similar to the pregnant patient situation. You might need to go a little bit higher than, typically right above the navel, which is okay. You also may need to utilize household items. So if there's absolutely no way that you can get your arms wrapped around this patient, maybe coaching them through doing the Heimlich maneuver on a chair, the back of a chair, or, if your partner has longer arms, utilizing your partner. It's all about utilizing your resources to ultimately remove that item that is lodged in their throat. If it is a taller patient, you might need to utilize a step stool or something to get to them. I really don't think anybody's going to be that tall where you need to utilize a step stool, but it could be a situation. In particular with kids, if there's an adolescent that is a little bit shorter than you, you're going to want to make sure that you get down on their level. That way you can perform that good abdominal thrust, because what they need is that object dislodged immediately. So at this time, we're going to flip over to the video, and I'm going to show you a little bit more in depth how to perform these maneuvers. Okay. And these are my references right here. Okay, so now that we have talked a little bit about choking and what exactly it is, we're going to do some demonstrations. So I'm going to show you just exactly how to perform the Heimlich maneuver. So like we talked about in the lecture, there is a partial occlusion and then there is a complete occlusion. So with a partial occlusion, you're going to see the patient coughing most of the time. And like we mentioned in the lecture, you're going to want to encourage them to continue coughing. If it's a partial occlusion, it means they still have a little bit of air. However, that partial occlusion can become a total occlusion very quickly. And when you do get that total occlusion, that is when you're going to want to utilize your Heimlich maneuver. So I do have somebody here that's going to help me. So she's going to be my patient. All right, so this is Bailey. Bailey's going to act as my patient in this situation. So basically what's going to happen is I'm going to be the paramedic or the EMT basic in this situation. I'm going to arrive on scene. Could have been dispatched out as anything. We're just going to say, for all intents and purposes, it was dispatched out as a choking. So first thing, I'm going to walk up and I'm going to see if she's coughing. I'm going to look at my ABCs. I'm going to form my general impression like I would in any patient assessment. So in this case, we're going to see that Bailey has a total occlusion. So as you see here, Bailey is performing what we call the universal choking sign. However, it's really important to know that these patients are going to be in distress because they can't breathe. And when you can't breathe and you feel like you're suffocating, you tend to freak out and panic. So not all patients are going to do this. However, this is a great indicator that they are choking and they do not have air access. So when I come up to my patient, I'm going to, first off, ask if they're choking. So if she has no air movement, she's not going to be able to talk to me. So as you saw, she just nodded her head yes. So that tells me that I need to go ahead and I need to perform the Heimlich maneuver. So what I'm going to do is, this is an adult patient, so I'm going to have you turn sideways just so I can demonstrate. So you're going to take your hands, you're going to place one fist right above the navel, and you're going to wrap your other arm around, and you're going to go in and up, and you're going to do a forceful thrust. It's almost kind of like you're scooping. And you're going to keep doing that repeatedly until the object becomes dislodged or until your patient becomes unconscious. So this is going to look different in different populations. So if you have maybe somebody that's a little bit shorter than you, so for instance, if Bailey was a child, don't be afraid to get down on your knees and get down behind that patient. And you might come to a point where it's a little uncomfortable. You might have to squat a little lower just to get into that correct positioning. You might have to get behind somebody, stand on a stool or something to get behind somebody that's a little bit taller. But it's important that you get right above that navel and you do that scooping motion. So we're also going to talk about pregnant patients. So what happens if you have a pregnant patient that is choking? So if you have a pregnant patient that is choking, I'm just going to demonstrate on Bailey. Typically their belly is going to protrude out a lot more. However, what you would do is you would go right above that baby bump. So you don't want to go too far up, but you do want to go, typically right above that baby bump and perform those abdominal thrusts that way. And for obese patients, typically do what you can. Try your best to get your arms around your patient. However, if you can't get your arms around your patient, what you want to do is you want to try and encourage them to sit down on a chair and perform the Heimlich maneuver themselves almost. Or if you have a partner that's got longer arms than you, utilize your resources and get help. So our next big question, because we were talking about what happens when our patient that we perform the Heimlich maneuver on goes unconscious. So I'm going to say, for all intents and purposes, that Bailey right here, I've been performing the Heimlich maneuver on her, and I'm still going, that item's not dislodging at all, and Bailey goes unconscious. So what you're going to do is you're going to carefully set them down on the floor. You don't want to drop them because then you could have just created a trauma. And from there, you're going to immediately start chest compressions. So you're going to do those chest compressions at your 30-2 rate. However, before you ventilate, you want to look in that airway and see if you can see the lodged item and see if you can remove it with some McGill forceps. Do not ever do a blind finger sweep. That is extremely dangerous and it could push the object further down. And so one more population that we didn't really get a chance to talk about yet are newborns and infants. So unfortunately, they do have a higher risk of choking, them and geriatrics, because at least for newborns, their airways kind of go down in a cone shape. Geriatrics is more related to difficulties with swallowing and using those muscles due to age. So what happens if you come across a choking infant? So what you're going to want to do is you're going to want to take baby, you're going to want to cradle their head with your hands. You don't want to close their airway off or anything, and you want their body to rest on your forearm, just like this. And so what you're going to do is you're going to either get into a squat position, or if you can find a chair or something, utilize a chair, but you're going to perform 5 back blows, and then you're going to cradle that head, roll them over, keep that head pointed downwards because you want gravity to help you, and perform 5 chest compressions. And so you're going to keep flip-flopping back and forth and performing this motion until either the item is dislodged or baby becomes unresponsive. And at that point, you're going to start doing straight compressions and basically working a cardiac arrest situation.